Trump got on Truth Social. I'm not going to read the full truth.
It's big.
That he truthed out, but it had me confused and feeling a lot of different things.
Confused, upset, perturbed that I'm seeing MAGA Maoism manifest itself in this way.
Yeah.
I don't know how to feel about it.
I don't know how to navigate this. And I don't think he knows how to navigate this either, as we'll go on and explain.
Oh, no, he's totally motivated by personal interest.
Yeah, because essentially what he truthed out was that he said, on Monday at 9 a.m., I'm going to be signing an executive order to fucking kill the pharmaceutical companies, lower prescription drug prices. For far too long have Americans been just being absolutely ripped off by the billionaires in the pharmaceutical industry. And then he kind of did it.
Yeah, Bernie Sanders possessed him for a moment.
Yeah, but like his plan is like weird.
Yeah, let's get into it then. Let's get into his plan.
It's not even really like a plan.
Should we listen to his announcement?
I think we should listen to his announcement video, or at least this was the preamble to his announcement, because I think this speaks far more to like Trump's motives than anything ideological, and certainly anything that's principally progressive. Okay, let's roll the clip.
I mean, I'll tell you a story. A friend of mine who's a businessman, very, very, very top guy. Most of you would have heard of him.
Top guy.
Highly neurotic, brilliant businessman, seriously overweight, and he takes the fat shot drug. And he called me up, and he said, President, he calls me, he used to call me Donald, now he calls me President, so that's nice respect. He's a rough guy, smart guy.
Rough guys.
Very successful, very rich. I wouldn't even know how we would know this, but because he's got comments. President, could I ask you a question? What? I'm in London, and I just paid for this damn fat drug I take. I said, it's not working. He said,
oh my God.
He said, I just paid $88, and in New York I pay $1,300. What the hell is going on? I mean, I'll tell you a story. A friend of mine who's
Trump discovered that prescription drugs in America are far too expensive than they should be, because his, billionaire, millionaire friend was like, hey, I paid less over here in London.
Yeah.
He's speaking like he was genuinely not aware of this issue until now.
And like, this has been an issue that progressives have been talking about for decades. Like back in the 2000s, Bernie Sanders used to take people from Vermont into Canada for cheaper prescription drugs.
And that was like controversial.
Yeah. Like, this has been an issue for a long time that, maybe Democrats haven't done enough, but they tried to make some progress on. But the entire issue here is the profit motive.
Yes.
Like, the entire reason that drugs cost more in America, that healthcare costs more in America, is because it's a privatized system, and you've got people at every corner of this system trying to make more money off of you. Like, that is so obviously the issue, especially if they're in the UK.
Yeah.
Like, what are we talking about?
It's also just like, You're fucking kidding me. We've been screaming about this for so long. We've been fighting for this for so long. Even Joe Biden got on the issue, trying in Build Back Better to get Medicare to be able to negotiate prescription drug prices just like across the board, where I think every Republican voted against it.
We in the IRA, Medicare is able to negotiate drug prices, but that doesn't start until 2026.
Yeah.
Same with the cap on insulin costs. Same with the, I think, $2,000 cap on like overall cost for seniors under Medicaid.
And Republicans
or Medicare
railed on that, calling it price controls, calling it communism, blah, blah, blah. And then Donald Trump gets out here and does this.
Yeah.
That's crazy. And he also gets out and here's my fat ass fucking friend. He's way too fucking fat. I told him he was fat, and he takes this dumbass fat drug.
I said it doesn't work.
And he's got to pay too much for his fat drug?
Yeah.
Can you believe that, folks? It's just like he doesn't go out here like, oh, this person that I heard about has cancer and they couldn't afford the treatments and so they died because of it. This is a problem that happens all across America. It's no, my fucking rich ass friend. He's rich as hell.
It's the same thing as when Marjorie Taylor Greene stumbled across the prison industrial complex when she went to go tour the DC prisons where January 6th protesters or rioters were being held, and she was like, "Oh my God, these conditions are terrible." It's like, dog, that's prison in America. Same thing here. Trump stumbles upon the issue of the pharmaceutical industry in the United States just by accident.
Like, these people are so incredibly out of touch,
yes.
And they're telling you how out of touch they are. I'm pretty sure everybody who's listening to this has paid too damn much for a prescription drug one time and could tell you that that's kind of egregious.
And you can tell that this isn't like a well thought out thing based on what his solution is.
Yes.
In the executive order, which essentially is to shift the cost of prescription drugs here in the U.S. Onto other countries.
Yeah.
so that we can pay a lower rate, but other countries have to pay a higher rate, even though they have universal healthcare systems where they use their government to get lower rates.
That's like functionally like what could be a consequence of it. In the like executive order that he signed earlier today, it's going to, per NBC, direct HHS Secretary Robert F. Kennedy to come up with a price-cutting goal within 30 days. White House officials said on a call Monday the move will kick off a round of negotiations between Kennedy and the drug industry. Not Medicare negotiating prescription drug prices, Robert F. Kennedy negotiating prescription drug prices.
Yeah.
Interesting distinction right there.
Again, a thing Democrats, like as a party, have been fighting for for years and years and years, letting Medicare or the federal government negotiate drug prices.
Yes. Denied by Republicans at every single turn.
And even that is a fucking Band-Aid solution on the problem that it's a privatized system that people have to make money off of in order to function.
And should talks between RFK and drug companies stall, Kennedy will move to enforce the, quote, most favored nation pricing model, which would cap U.S. prices at the lowest rates paid by other wealthy nations. Effectively, what that would do is what Jeremy said, where drug companies are just going to raise prices in other wealthy nations to compensate for lost profits here.
It does confuse me a little bit because there are some countries, I think like the United Kingdom, who have single-payer systems where the government literally just runs everything. Right, there's no private actors that they pay. Like in countries like Germany, they still pay private companies for, you know, like hospital services and stuff like that. The government itself doesn't run the hospital, but at the point of service, the patient isn't paying for anything. Right, it's different in some countries. But I'm confused. Like if drugs are literally $0 in the United Kingdom, are we going to set like insulin or whatever else diet, you know, whatever other medication people need at $0 because that's what the UK pays?
Are we going to pay what NHS pays for the drugs?
Right.
Like there's no framework for any like meaningful change to actually happen. There's no actual policy here. Like that's what's fucked up about it. And it's like that's what's wrecking my fucking brain because it's like I would love if Donald Trump came out here and said Americans are no longer going to be ripped off by pharmaceutical companies and actually do something meaningful. But it doesn't seem like anything meaningful is going to come from this.
What it seems like to me is that Donald Trump has stumbled across a systemic issue.
Yes.
And for some reason has decided he wants to do something about it.
And it's like the first time he's ever heard about it, by the way. He's 80 years on this planet.
It's the first time he's heard that drugs cost more in America for some reason. And rather than going after the actual issue, which is the fact that companies profit off of the creation and sale of these drugs, he's trying to maintain profit margins for those companies by shifting costs onto other populations.
Because that's just how it would have to happen.
And I don't know how you get there without like an export tariff or something like that. Or I guess if pharmaceutical companies just raise prices when they sell to like the NHS or to Germany or something like that.
I think it would genuinely just be like a supply-demand curve thing. Like, okay, they have to make up for lost margins from selling to America, so they're going to have to raise prices in Germany and the British NHS.
Yeah.
Like it just seems like we're shifting the problem to another aspect rather than addressing the actual issue, which is like you said, the profit motive in healthcare.
Yes.
Because when you have something so essential to human life, like healthcare, be run by the need to constantly be making more and more and more and more money, the actual product, which is essentially making people's lives better and making people healthier, is secondary to the product's ability to give money to the shareholders of the company.
Yes, yeah.
And you just can't have a functioning system like that. You can't have a system where there isn't inherent exploitation on arguably the most vulnerable people among us, the sick population, without addressing that.
And again, the only reason that American drug prices are higher is because it's a private system.
Yeah.
That it's the only variable in this equation here is because we have an entirely private system. Of course, Medicare exists and Medicaid exists, but that's nowhere near like even a public option, for example.
It's not the NHS.
Other countries have cheaper drugs because their government runs the healthcare system. Like you said, it's an essential good. And as long as it's left up to the free market, insurance companies, drug companies can charge you as much as they want because you need it to live.
Yeah.
So that's the problem.
It's pretty bad, and I don't know. Maybe Trump will get there. Maybe Trump
accident.
Maybe Trump is having a Maoist awakening.
I don't know, man.
Maybe Trump's gonna Mao the pharmaceutical industry.
He's gonna like fall backwards into universal healthcare by accident.
Who knows?
Fuck, dog. If that's what it takes at this point.
Next thing you know, he's gonna say, my fucking fat ass dumbass friend over there wanted to go get liposuction. That shit was hella expensive. I can't believe how expensive surgeries are in the U.S. We got to do something about this. We got to do something about these insurance companies.
That's the thing is like on its face to me, what it looks like is similar to those executive orders that he wrote back in January, where he basically basically said, I'm ordering every department to find all the waste, fraud, and abuse in 30 days.
Yeah.
And then report back to me, and nothing fucking happened. Or they just cut a bunch of essential services and fired a bunch of essential workers. I think something like that's going to happen here, where RFK is told, go find all like the places where we can cut costs on drugs. He'll come back with essentially nothing, and then nothing will change. Or maybe we will just get like MAGA price controls.
That'd be kind of gas. I fuck with that.
And then Eli Lilly will like depose Donald Trump somehow. I genuinely don't know where this goes. It's hilarious that he just kind of like walked backwards into this. But it's important to note, like, this is not a principled solution to the issues that we face in healthcare. And therefore, it will not be a comprehensive, it will not comprehensively help people in any real way.
And like, again, it's not like real.
Yeah.
Like, this isn't policy like Medicare negotiating prescription drug prices is policy.
Yeah.
You know what I mean? That, when it goes into effect in 2026, will be real and impactful in measurable ways that we can understand and predict.
Yeah.
This is just homeboy rambling and doing an executive order, which will honestly likely even be struck down by the courts if it is implemented.
I was about to say, I wonder if it's even constitutional for him to issue price controls.
I don't think so. He tried to do something similar in his first term that was shot down.
Yeah. And I think like there was some shit Joe Biden tried to do that didn't work. Of course, the $35 cap on insulin was legislation.
Yes.
Which, of course, legislation can literally do anything. It's legislation. I don't think he has the power to just issue price controls.
You think he'll become so passionate about this issue that he'll whip Congress?
I mean, this might be the test. Like, Republicans have fallen in line for everything. They are, like, Republicans in Congress are explicitly there to serve the wealthy.
Yeah.
Like, that's why they got their position. It's how they got their position for, like, super PAC donations.
We could finally see the lobbyists go after Trump. The pharmaceutical lobbyists turn their back.
I wonder if Republicans will, like, the Republican Party puts their foot down on protecting these poor mom and pop pharmaceutical industries.
Imagine they work something like this in a budget reconciliation.
We're capping all prescription drugs at $5.
Hell yeah, brother.
I mean, shit, dog. If this is what it takes.
Hell yeah. It wouldn't make the other things worth it, but broken clocks. Good things are good, bad things are bad.
Yeah, I have a feeling this won't happen.
I have a feeling nothing's going to happen, and it's really annoying to say that because I can already see everybody on Twitter, and I have already seen a bunch of conservative accounts on Twitter being like, oh, Democrats want you to continue to pay more for drugs. How are they going to criticize Donald Trump for this one? It's just like, let's use our brains.
I'm criticizing it because it's it's an idea that's clearly not thought through.
Yeah.
In any real way. Like you said, it's not really a policy solution. I'd be cool with anyone doing price controls on drugs.
I want it to be a policy solution. This just isn't. At least in its current form right now. Maybe on Thursday it'll be a policy solution.
We talked about price caps, I think, with like housing when Kamala Harris was running for president, right? Because she had a price cap idea.
There was something, I think it was about in how she would handle like inflation and greedflation, because they finally wanted to start talking about that at the 11th hour, where conservatives said it was groceries, where conservatives said she's doing price controls. This is communism. Look at her radical Marxist daughter.
Yeah, and like what we said at the time, and this is just like always my take on price controls, because it's kind of just like the economics under a private system, is that like price controls are not a holistic solution. Because when it's a private industry, they do need to make profit off of the product or they'll stop making it. Establishing price controls below a profitable level will just mean private actors stop, which means people don't get like access to groceries, access to healthcare, housing, and so on. What you need is to decommodify the service, which Trump is not going to do.
Or just state subsidy on the way to decommodifying the service. Like, you just do state subsidy to keep prices low and negotiate profit margins with the companies to make sure that the government isn't being ripped off by those things.
Yeah, the issue is that it's privately owned. Like the relationship between consumer, worker, and the person that owns the product is clearly the issue here. The issue isn't that it's just too high. The reason it's so high is because it's privately owned.
Yes.
So the price is sort of downstream of the relationship we have to the product in society. And Trump isn't going to solve that. Price controls in some aspects, especially on like a city level. Like, I know Zoran running for NYC mayor. Like, he can't decommodify housing entirely in New York City. So I'll take rent control. You know what I mean? I'll take that as a solution. But price control generally just isn't optimal in some cases.
It's hard because, like, obviously you have to contend with the system that we live in, and within that system it is a suboptimal measure that you can, it's a band-aid. It's a band-aid that can work maybe temporarily in times of crisis.
And like some people that are like pro private health insurance, which is, few and far between, but they'll argue that like, oh well, companies charge so much because of R&D. But it's like, we look at like insulin, which has been around for what, ever. Didn't the dude who made insulin say this should be like $1? He sold the patent for $1?
$1.
Like, we clearly we can clearly produce this cheaply. And when price controls come for like something like that we've had for a long time that we know how to produce, I'm cool with it.
Then they could stop reformulating it every 7 years to get the new patents. You know what I'm saying? It's
exactly.
It's a little silly. And it's like the R&D could also be replaced by state subsidy.
And it is in a lot of cases, except under the Trump administration, because they cut a lot of that.
That's how academia used to work. In, you know what I'm saying?
Last year.
It worked. Last year, a couple months ago, that's how academia worked. We actually have a robust system that we could use to offload R&D costs.
Yeah.
And make it a public thing, but the problem with that is then the results of that R&D would have to be available to the public and not overpriced.
Yeah, so you'll have to forgive me for doubting the sort of internal consistency of this idea.
Yes.
Something might happen. He might claim victory in some way, but I somehow doubt that anything serious is going to happen.
If it does happen, that'd be pretty cool.
Oh, I'm a MAGA communist.
That'd be pretty cool. You know what I'm saying?
Exactly. Good things are good, bad things are bad.
Precisely. We got right there.
But when you don't have a principled position in like worldview, it's hard to make policy that actually functions, which is why liberals suck a lot of the time.
Or when you just like think you're the king, it's hard to make policy that functions because you think that you can just tweet something and it's law.
And I thought it was very funny the way that Donald Trump talked about it in his Truth Social post, because he made it seem like Republicans have been fighting against the pharmaceutical industry and Democrats have been fighting against solutions like the one Trump is proposing. Brother, you'll find far more purchase among Democrats for price controls than you will Republicans. And maybe that dynamic will flip just because of negative polarization. I don't know. But like, if we're talking historically, it's very clearly been Democrats trying to do price caps on shit.
Quite literally, 4 years ago? 4 years ago, we had every conservative say, no.
Yeah.
You need to pay more money for prescription drugs.
Insulin's the most justifiable one to price cap.
Yes. They said, no, actually, you need to pay a lot for every bottle of insulin.
Exactly.
You really do.
Die.
We have to protect Eli Lilly's margins.
Or die.
If
you don't pay for it, you can just die.
There's inelastic demand, and that's good, because then that means we can push the price like way high.
Well, and if we don't restrict people's basic necessities, they won't go to work anymore.
True. If you could have everything you needed to live, like insulin, why would you get your ass up and get a job?
People that have free healthcare, they don't work nearly as hard as we do.
Precisely. Like all these 24-year-old healthy men on Medicaid.
We need you to be on the brink of death. Otherwise, you won't work. No, this is not a coercive system.
Exactly. Yeah.
We need to have a metaphorical gun to your head. Otherwise, we can't get you to work at your job.
That's pretty good. That's pretty good.
Yeah.